We actually have our roots in the Civil War with the Dr. Reese, for whom Reese School here in town is named. He was here and had a hospital from 1864 to 1866. I think when we say hospital, what it really was just 5 rooms, and then he did surgery on the 2nd floor.
He was a military person, and he was reassigned from that hospital to Fort Leavenworth. He was in Fort Leavenworth for a period of time, but he loved Warrensburg so much that he came back. He married a nurse and established his practice here.
At the turn of the century, about 1908, it became the Oak Hill Sanitarium. Now, Dr. Reese's hospital was on Gay Street, and then when it became the Oak Hill Sanitarium, it was on Holden Street for a while, and then moved over to Market Street. The doctors realized that it needed to grow. The city of Warrensburg was growing, the surrounding area was growing, and at the same time, not only could they not afford to build a larger physical plant, the state also was getting more involved in medicine with some rigid laws, and so they announced that they were going to have to close the hospital. The city of Warrensburg and Johnson County all came together and realized the important part that the hospital played in the community. And so in 1960, they floated a bond issue, and in 1963, Johnson County Memorial Hospital opened. And that's on the current site where we are today. In 1986, the name of the hospital was changed to Western Missouri Medical Center. And then in 2010, they completely redid the structure, the beautiful structure that we have today. The hospital went on in 2013 to build the medical building. The hospital and the community continue to grow, and the hospital, I think, continues to meet the medical needs of the community.
When I came to WMC, I was the Chief Nursing Officer in 2013, and at the end of 2015, I took over the interim role for CEO, ultimately accepting that position in February of 2016. So the last 7 years, I have been CEO. I always say that every CEO that served at WMC had an important piece of our history. We had a long-term CEO that was able to save money around 2010 when we decided to build a new building to keep up with the momentum of private patient rooms with every other hospital. That really transformed the way we give care here. Then we had a CEO that was really interested in making sure that we were providing the right care, so the best quality with the right specialists. And so we set that groundwork with bringing in some other partners to help us really advance our abilities. And I think that we've continued to do that. In my time, we acquired the physician practices here in town, which allowed us to have more care coordination across the continuum. But we also have been able to support those practices to recruit new physicians to the area. So we are laying the groundwork for a flourishing medical community for the next 35 years.
I really believe that seeing the hospital grow and develop, the number of doctors who have come to the hospital, the specialists that are here, I think that's the most rewarding thing that we have seen at the hospital. The tremendous operations that are being done here, the cancer treatments that are being done, the fact that we have the complete trauma center for strokes and heart attacks. That's really something for a community hospital. Each one of the administrators saw something in this hospital that needed to be improved. And I think they have brought that, and I have watched that over the years.
Certainly the growth of the hospital and bringing so many wonderful new physicians in so that we have a lot more areas that people can use in place of having to go to the city. That's been a wonderful, wonderful thing.
Even after working here for 20 years, sometimes when I come in, I get lost. The hospital has grown so much. So many more physicians now, specialists, more opportunities, more employees. A lot of times at the board meetings, we are fortunate to have a manager from another department come and give us a little rundown on their department, what's been going on. And it just amazes me how much intelligence there is in our hospital.
We have really committed at Western Missouri to recruit quality physicians to this area. We are fortunate enough to have been successful in many recruitment efforts, and I think it is largely due to the nature of this community. The thing that attracted me most to WMMC in the beginning really was that sense of family, that connectedness that we have. When we walk down the hall, we see people that we know their name, we say hello.
I know a lot of people say that the hospital is their second family, and it really is. It gets to be that way. When my parents were living, they loved to come here. They were both in the hospital on several occasions, and they treated both of them like they were the king and the queen each time they were here. And they loved that, and so did I. It was very important to me.
I'm a manager of EVS, and I've been here for 45 years. I started out in nutrition. I think I worked there 4 years, and then I transferred over to housekeeping. I've been there ever since. My dad started here, he worked here, had all 4 of my daughters work here at one time. My granddaughter has worked here at one time. Now my husband works here. So like I said, it is like family.
I have 2 of my children have worked here. My oldest son is an RN, and he worked in the emergency room. He actually started in the lab as a phlebotomist. My son Tim works here. He's been here about 10 years, I think. He works in Central Sterile. So we really are a hospital family, and we all love it here.
What I would like to see my legacy to be is really more about, yes, patient experience, but also employee experience. I feel like we have a really strong responsibility to this community as one of the largest employers in the county.
Well, I do think the hospital is very forward-looking. I can't even imagine what medicine will be like in 60 years from now, but I can only think that the Western Missouri Medical Center will rise to the occasion of whatever that is.
I was a part of Warrensburg when the hospital was down on Market Street. And so it's such a tremendous difference, and I have seen all that growth, development. It's rewarding, it's satisfying, and I think speaks well for this community.
I just see constant growth all the time.
I think it's a good impact. We need it here. I wouldn't want to go anywhere else. The community needs us, and I'm happy to be here for them.